and in Australia, we support the Narcotics Drug Amendment Medicinal Cannabis Bill 2021 because it does implement a large number of the recommendations of the Macmillan report, and that's why we will be supporting this bill. Implementation of medicinal cannabis in Australia was reviewed by Professor Macmillan of the Australian National University in 2018, and the report presented to the government in July of 2019, almost 2 years ago. One Nation has been attempting to get this legislation before the parliament since November 2019. Finally, after almost 2 years, here it is. And what a moribund display. Professor Macmillan's report looked at the supply side of medicinal cannabis, not the medical decision-making. That was a shame, as the pathway system is heavily flawed. Medicinal cannabis will remain out of reach of everyday Australians who are unable to navigate the obstacle course put in place by the government that was seemingly designed to prevent large-scale access. They want to stop this. My constituents in rural and regional Queensland find it especially hard to access a doctor approved to prescribe medicinal cannabis. It would appear that prizing the pharmaceutical industry's hands off prescription pads is a task for which this government lacks the will. In fact, we've seen an orgy of spending on pharmaceutical industry products in recent months without the slightest attempt at safety testing. Products that the Chief Medical Officer, the Therapeutic Goods Administration and the Secretary of the Department of Health refused to endorse as 100% safe. Compare that sloppiness and lackadaisical approach to the rules applied to medicinal cannabis, where thousands of years of experience and 30 years of research established the safety of medicinal cannabis is far in excess of the experimental, provisionally approved vaccines that this government rushed to purchase and is now forcing on an unwilling population. This bill, though, is long overdue. The changes to licensing will have a significant impact. Previously, anyone wanting to invest in medicinal cannabis production needed to apply for separate licences for growing, processing and production, each lasting 12 months and issued at different times. Each licence had fees and endless rules, which created a huge compliance cost and introduced a substantial risk. Any cannabis business was in danger of losing their licence at any time, through no fault of their own. It takes a year to build out a production facility, with no guarantee that the licence would be renewed. What incentive was there for small players to invest in medicinal cannabis? As a result, the industry has become dominated by a small number of publicly listed companies. As with any industry, Madam Acting Deputy President, competition is king. A heavily regulated industry occupied by a small number of corporates is not in Australia's best interest. And I'm pleased that Professor Macmillan saw that. This legislation combines the 3 licences into one and extends the term to 5 years with no automatic renewal for companies with an automatic renewal for companies with a good record of governance. This will encourage new and smaller entrants to enter the market, and in turn prices will fall, and that's what we need. The new licence for research is also a good measure. Research is currently funded by powerful interests associated with maintaining the status quo, no medicinal cannabis, rather than those seeking to expand human knowledge of the wonderful new world of the human endocannabinoid system. I look forward to new findings on the effects of the 460 compounds in cannabis that interact with the human endocannabinoid system to help our bodies heal themselves. Heal themselves. That's what's beautiful about medicinal cannabis. The benefit of medicinal cannabis, documented in pharmacopoeias dating back 200 years, is now proven with medical research around the world. So very little of that research, though, is Australian. This new research licence should create a new avenue for Australian academics to do something useful for a change. There's still much to be done when cannabis comes under the pathway system in Australia. Costs 100 times what the same item costs in the United States. Australians deserve far better. A One Nation initiative last year saw a relaxation of the licensing system for the production of cannabis for export. Now, I do believe the cannabis community missed a huge benefit in the Export Control Act 2020 amendment. Australia is now seeing the benefit of that legislation, with new facilities under construction, increasing supply and lowering the retail price for domestic sales. Not to mention bringing jobs and wealth into local communities legally. A new $400 million facility has been announced near Wellcamp Airport in Toowoomba, set to open the year after next. This facility will export $1 billion worth of cannabis to the world market. With those export volumes will come further reductions in the price charged to Australian patients. Now, with the sensible changes to licensing in the Narcotic Drugs Amendment Medicinal Cannabis Bill 2021, price reduction should flow through quite quickly, and we're pleased to see that. One Nation is proud of the work we've been doing these last 2 years to bring Australian whole plant, natural medicinal cannabis to anyone with a medical need, by doctor's prescription, supplied by a chemist. We also note that the government is looking to reschedule low-THC cannabis into Schedule 3 as an over-the-counter, chemist-only medication. One Nation supports that reschedule, enthusiastically supports that reschedule, and would ask the government to get on with it. And we are happy to work with the government in improving in any way medicinal cannabis access by the people of our country. Thank you.
Senator